Hello, my name is Faith Boyce and I'm a nursing student at HAC. Today I'm going to demonstrate a sterile dressing change. Hello, my name is Faith Boyce and I'm a nursing student at HAC. I'm washing my hands. Would you please tell me your name and date of birth? Thank you. I'm going to pull the privacy curtain. So today I'm going to change your dressing. How does that sound to you? Do you have any allergies? So first of all, I'm going to have made sure that my patient has their pain medication. I'm going to confirm the doctor's orders that I have a dressing change, and I'm going to put on gloves. I already washed my hands. I'm going to put on gloves because I might come in contact with some of the fluid on this dirty dressing. So I'm going to be careful when I loosen my dressing to pull towards the wound so that I don't pull on the wound. And then when I lift the dressing, I'm going to lift it so the patient can't see what's under it, and I'm going to look what's on it. So I'm going to be looking for color, for odor, for consistency, and for amount of the drainage. And this is clear. There's no drainage on this, so that's good. Then after that, I'm going to observe the wound area. I'm going to observe for redness, for ecchymosis, for edema, for drainage, and for approximation, and my wound looks good. So now I'm going to take off my dirty gloves, throw them away, and now I'm going to wash my hands very good. I'm going to clean my whole area, my whole bedside table with alcohol. I'm going to wipe down the sides too to make sure those are clean, and I'm going to gather all my supplies. So I have them right here, but pretend I didn't have them. I'm going to gather them now. I'm going to gather two gauze, an abdominal pad, alcohol swab sticks, and I put a piece of tape here so that I can easily tape that when I'm ready to open it. And I have my sterile gloves. So I'm going to start by opening the abdominal pad. Let me move the swab sticks over here. So I'm going to carefully open it. I'm going to be very careful when I open it that I don't touch the edges, like taped edge. I'm going to be careful not to pull my arm over it once I've opened it. Do helicopter technique, and I'm going to carefully drive it. I'm working in a small space, so it's kind of hard over here. I'm going to carefully drive it over here so it's out of my way. And now I'm going to open my gauze. I'm going to be careful not to touch the glued edges, and I'm going to be careful when I move my thing over that I'm not hovering over anything, not hovering over the ones that I opened already. I'm going to be careful not to touch the glue. I'm going to make sure that the gauze has not touched the glue, because then that means it's not sterile anymore. And I'm going to open my last one. Okay, I'm being very careful. Do not touch the glue. I made sure my gauze has not touched it, and I'll be careful when I'm driving this to not drive it over anything else. I'm struggling with my space confines because I need to keep everything in my sterile field. Okay. Alright. Now lastly is my alcohol swab stick, so I'm going to carefully tear it one way. I'm going to tear it the other way. And I'm going to lift straight up. And I'm going to throw this away. And I'm going to push these up so that I can have easy access. And I'm going to tape it right to my edge. My edge is kind of funny, it's not quite straight. Okay, now I'm going to open my sterile gloves, and I'm struggling with my space confines here a little bit. The top edges are not supposed to go down on the corner here, but I don't have anywhere else to do this, so I'm just struggling with my small space. So just for the sake of this, I'm going to drive these a little bit more. But they're not supposed to be that way. I'm just really struggling for space. So I'm going to open these. Please stay open. Okay, so I'm going to pinch first. I'm going to pull off. And I'm just going to, yep, that one's on. Now I'm going to come over. I'm going to anchor this with my one finger. I'm going to scoop. I need to get a good scoop here. I'm going to lift off. And keep my hitchhiker thumb. And that's good. Now I am sterile. I'm going to take this, throw that away. And now the first thing I'm going to do is clean my wound. So I'm going to start with the center first. And I'm going to carefully clean down it. And then I'm going to be careful not to go over any sterile field and put it right in the trash. Oh, when I was doing my approximation, I was assessing that all the staples were there. I was counting how many there were, all that. And I'm going to clean the outer side next. Going to be over. And throw it away. Careful not to cross over my sterile field of the swab sticks. I know it's kind of in an interesting place. And now I'm going to do the next one. Clean over that side, top to bottom. Be careful not to go around my sterile field. Okay, so I'm done with the cleaning. Now I'm going to very carefully pick up my gauze. I'm going to set it on the wound, make sure there's no wrinkles or anything. Pick up my other gauze, going to set it on the wound. Make sure there's no wrinkles or anything. Okay, now I'm going to pick up my abdominal pad. And I'm touching the edges. Now my hands are going to get contaminated because I'm going to touch the skin. I'm going to carefully cover the whole thing. And now, since the wound is clean and everything, I can take off my gloves. And I can throw them away. Sanitize my hands. Now I can tape. I can tape my, so I need a piece about that long. Struggling with my tape a little bit, it doesn't want to rip. So I'm going to be very careful not to have any wrinkles to make sure this is taped nicely. Because wrinkles can cause skin breakdown. make sure the edge of my gauze isn't, my abdominal pad isn't wrinkled either. So I'm going to make sure that's straight. I'm going to make sure that's straight. Okay, no wrinkles, nothing, and now I'm going to write my name, my initials, my title, and the date. Okay. I'm going to take that piece of tape and I'm going to put it right here. So I'm done with my sterile dressing change. I'm going to get rid of all my papers and throw everything away. Wash my hands. Make sure my patient has their cowbell. Make sure they're comfortable. Make sure the bed's in the lowest position. Make sure there's nothing else I need to do before I leave the room.